So what are you guys doing this weekend?
I don't know. I think I might have a date with this cute guy.
Oh. Where'd you meet him at?
We kind of got on a couple dates, but like now he met my parents, so yeah.
Aww.
I don't know. We'll see. We'll see where
how it goes.
Yeah, I'll text you guys. I'll probably be texting you throughout the whole thing.
Good. Yeah. Perfect.
Yeah. So, thanks for taking me on this
Oh
date.
yeah. So you want to go back to my place for a drink?
Yeah, that sounds good.
So why didn't you get a drink?
I haven't gone to the doctors yet.
You should probably go there to like get information about prenatal care. Yeah. It's definitely an important part.
I don't know if I can afford it though. I don't make a lot of money. I can't afford to get those pills and all that stuff.
We could see what options you have. They should be able to help you with things like that too. If you talk to the doctor.
I just don't know if I want to talk to the doctor. It's embarrassing. I don't know anything.
I understand that. But we're here for you. We can go with you if you want.
You guys will go with me? Okay.
Hey guys.
Hey.
Hi. Let's do some research about prenatal care before your first appointment.
Okay. Yeah, that would make me feel better.
Yeah. All right. Well, it says that prenatal care is when a pregnant woman receives care from an obstetrician or a midwife. Services needed include dietary and lifestyle advice, weighing to ensure proper weight gain, and examination of problems for pregnancy such as edema and preeclampsia. Some tests that you might have. So they want good health of the women and the baby, so regular checkups and prenatal testing are necessary. A woman can give birth in a hospital, birth center, or at home. The presence of certain health problems or pregnancy complications may prohibit a home birth. Typically, a woman's age, family history, medical history, and pregnancy risk factors are assessed during the initial prenatal doctor visit. A breast exam, pap test, pelvic exam, and cervical exam may also be performed. They're going to check you for anemia, Rh factor incompatibility, toxoplasmosis, hepatitis B, syphilis, chlamydia, and HIV. They'll also determine your blood type and your immunity to rubella and chickenpox. They're going to do ultrasounds, amniocentesis, quad screens, and a urine test to determine certain factors such as gestational diabetes, preeclampsia. You will have all additional tests. Prenatal costs can be expensive. Programs and services are available to help women get the care that they need.
Yeah, good point, Shay. With regular prenatal care, women can reduce the risk of pregnancy complications, reduce the fetus's and infant's risk for complications, and help ensure the medications women take are safe.
Oh my gosh, this is some serious stuff.
Yeah, I did not realize how important all of this stuff was.
Yeah, I also found some information about the past of prenatal care. In the early 20th century, obstetrics was not yet a specialty, prenatal care was not organized, and most deliveries occurred within the home. However, nurses were involved actively in starting prenatal care programs, initiating home visiting prenatal services, and participating in government programs to reduce maternal and infant mortality. In Boston, nurses visited pregnant women and provided emotional support and self-care instruction. In New York, 2 teacher nurses provided prenatal care and instruction for women who were at least 7 months pregnant, and infant mortality was reduced dramatically. Nurses also played a key role when the Maternity Center Association was established in 1918 to coordinate prenatal care centers in New York. Nurses conducted home visits, screened for complications, and taught women about childbirth and infant care. Further historical events changed care for childbearing women. In 1925, Mary Breckinridge introduced nurse midwifery to rural women in eastern Kentucky. Midwives provided prenatal care and instruction, and physicians served as consultants. The maternal death rate dropped and infant mortality fell to less than 3%. However, by 1930, physicians began to provide prenatal care as medical schools include obstetrics in their curricula. The place for giving birth also began to move from the home into the hospital. As a result, care previously provided by nurses shifted increasingly to being physician-controlled and hospital-based. Today, more than 98% of births in the United States occur in hospitals. Oh yeah, when you go to the doctor, you'll probably see a physician, and then also nurses play an important role too. It says that prenatal nurses help mothers who are expecting to avoid and recognize health problems that might present before, during, or after birth. The specialists aid the mother in learning and implementing healthy habits during pregnancy. The nurses work closely with parents throughout the gestation period. They might care for children in academic settings, help parents connect with local resources, and teach breastfeeding techniques or parenting skills. So,
I found a really good video that kind of sums up everything, so if you guys want to watch that, we can.
yeah, that'd be cool.
In medicine, we don't often affect the care of more than one patient at a time. With prenatal care, we have two patients, the mother and the fetus. Prenatal care includes a series of office visits spanning the pregnancy to postpartum. Also performed are investigations throughout. The goal of this care is to minimize morbidity and mortality for both the mother and fetus, and maximize the chance for a safe delivery. Understanding your patient's medical history is very important, as medical conditions can affect health of the pregnant woman and fetus. Conversely, pregnancy can also affect the course of medical conditions. Each medication, prescription or over-the-counter, needs to be reviewed, as many are not considered safe in pregnancy. No medication should be taken unless necessary. Blood tests during pregnancy screen for common conditions such as anemia and diabetes. Ultrasounds tell how many fetuses are present and uncover genetic conditions, congenital anomalies, and problems with the placenta. Knowing your patient's gestational age and estimated due date is key in the timing of tests. If her last menstrual period is known, a simple rule is to add 7 days and subtract 3 months for the due date. Early ultrasound measurement of the fetus can aid in dating the pregnancy. After pregnancy, one last visit covers how the patient is recovering from delivery and time for contraceptive counseling. Close care of the pregnant woman makes for a safer pregnancy and delivery for both the mother and the baby.
Okay, I'm ready to go see a doctor now.
Nice to see you again. How are you feeling?
Good.
Hi.
All right, let's go ahead and take an ultrasound.
Okay.
And if you look over here, here's your baby. What? Now let's listen for a heartbeat. There it is.
Oh my gosh.
Hey.
This is happening.
Hey Taylor, we think you should go to the doctor and ask him some questions and get some prenatal care information.
Yeah, I think we should figure out, how to handle this.
I mean, I think I'll be fine. It can't be that hard. Like, I'll just go to the doctor when I'm ready to have the baby.
Okay. Whatever you decide.
I mean, I think I'll be okay.
Hi, it's good to see you again.
Good to see you.
Let's go ahead and do an ultrasound.
Okay.
You look over here. There's your baby. Now let's listen for a heartbeat. I'm sorry, I don't seem to find a heartbeat. I'll give you 2 a minute.